Welcome. This mini education session is meant to be a resource for families of children and adults who have a sensory condition. BRAVE is a program we use at Lakeland Regional to provide the best individualized care to patients who have sensory conditions, and we want to take some of our techniques and share them with you. I'm Jillian Haley, Certified Child Life Specialist, and I will be taking you through this session where we will discuss autism and sensory meltdowns. We will also teach you the de-escalation approach that we use at Lakeland Regional when working with individuals who are in the midst of a sensory meltdown. We want this session to help you to feel supported and better prepared to care for yourself and your loved one. In 2019, the CDC released an updated report that stated that 1 in 59 individuals in the United States are affected by autism. Autism is certainly not the only sensory condition, but it is one of the most prevalent. Much of this session will use autism as an example, but the resources are applicable to any diagnosis that is sensory specific, such as sensory processing disorder or any pervasive developmental disorder. Autism is characterized by challenges with social skills, repetitive behaviors, difficulty with speech, and other nonverbal communication. Why is it called a spectrum disorder? Spectrum disorders are characterized by having a wide range of possible symptoms, challenges, and traits, and each person with autism has a distinct set of strengths and challenges that can differ significantly from person to person. As most of you are well aware, sensory disorders often have a large range in how they affect each person. One individual with autism might go to 3rd grade, play in Little League, grow up and go to college, get a job, and live entirely independently. Another individual with autism may need help with everyday tasks like bathing, feeding themselves, getting dressed, and they may need full-time care for their entire lives. Yet both of these individuals have the same diagnosis. Some people assume that those with autism all have the same sensitivities. This is a misconception. Not every person with autism is going to have the same prescription of symptoms. Some individuals will present with variations in sensitivity to sound, some mild, some severe. Some individuals will be sensitive to everything. This is the difference between having a high-functioning loved one with autism versus a low-functioning loved one with autism. You might have heard the quote, "If you've met one person with autism, you've met one person with autism." Every single one of you has a loved one with their own unique strengths and challenges, and we want to help you find the best way to support them. In 2013, the American Psychiatric Association added sensory sensitivities to the symptoms that help diagnose autism. To help understand sensory sensitivities, we will discuss hypo versus hyper sensitivities. For one individual, they may experience a low or minimal response to sensory input. This is called hypo. And on the other end of the spectrum is hyper, which means a person can have an extreme sensitivity to a particular sensory input. For example, many individuals on the autism spectrum may be overwhelmed by bright lights, loud noises, or certain types of touch can feel extremely uncomfortable or painful. They would classify under the hypersensitive category. While others might love loud music and sounds, many find food boring because their ability to taste is limited, or some of these individuals have a muted sense of touch, meaning that they may not even notice pain or being injured, which would put them in the hyposensitive category. Understanding how your loved one processes sensory information can help you to understand their preferences and triggers and how to best modify your approach to their care. Let's use sensory input as an example. Imagine that each day we wake up with an empty water glass, and all throughout the day, sensory information is like water dripping into our glass. Every time our cell phone dings, loud music plays, the sun glares into our eyes, or we battle for elbow room in a crowded mall, It is sensory information that is filling up our water glass. Now imagine that you have a sensory condition like autism. Your glass may be half as tall, and certain stimulus may be a splash of water rather than a drop. What happens when the water glass gets full? This isn't a trick question. Obviously, the water spills over. That spilling over is the meltdown. There are many ways to prevent meltdowns, to prevent the glass from filling up in the first place. But once a meltdown has started, there isn't a way to make it stop on demand. We cannot undo the overflow once there is too much water for the glass. So now that we've discussed the mechanics behind a meltdown, we need to talk about what a meltdown actually is. A meltdown is an extreme emotional behavioral response to stress or overstimulation. It triggers the fight, flight, or freeze response, which releases large amounts of adrenaline into the body, creating heightened anxiety and causing the individual to react instinctively to protect themselves. When someone is in sensory meltdown, their protective instincts take over and they enter into a form of survival mode. And in this scenario, we, and anyone who is trying to care for them, are the lions, and that individual in meltdown is the prey. When they lash out to try to hit you, or when they try to escape the room, they are simply following their brain's command to get to safety. Meltdowns tend to end in one of two ways. One is fatigue. They wear themselves out. The other is a change in the amount of sensory input they are receiving. This can help them to feel less overwhelmed and help them to get back to a point of self-regulation more quickly. A person with autism has no control over their meltdowns and will not benefit from normal measures that you would use to reduce a temper tantrum, like distraction, hugs, incentives to behave, or any form of discipline. As the caregiver of someone with a sensory condition, you most likely have their warning signs down to a science, but you might struggle with how to help your family, friends, or other caregivers understand how to recognize when your loved one is being escalated. It is important for you to know that some individuals report that meltdowns are essentially blackout moments for them. Not everyone experiences meltdowns the same way, but there is anecdotal evidence to support that many individuals who enter into a meltdown have an amnesic event and frequently don't remember anything that happened while they were in meltdown. Imagine for a moment how that must feel for that individual, to come back to awareness, feeling bone tired, sore, possibly injured, learning that you lost control of your body, of your mind, learning that you were the one that gave your caregiver that black eye, that you were the one that punched that hole in the wall. Imagine what it must be like for kids with autism to suddenly not have any friends because they had a sensory event at school and now they're considered the weird kid. Or to be an adult and not know when your brain is just going to take over and make you lash out at the people you love. I'm sure that you can imagine how they must feel because you live it with them. You and they most likely feel scared, confused, guilty. Yet they have no control over their brain's response to stress. Caring for someone with a sensory condition isn't easy. It takes patience, forgiveness, and resilience, and every single one of you is incredibly strong. What can cause a meltdown? Sensory overload, sudden change or being surprised or caught off guard, not understanding the reason behind that sudden change. People in authority failing to explain carefully, sequentially, and descriptively what will be happening in any situation. Someone failing to respond to an autistic individual's questions in a concrete, literal fashion, or being asked to multitask or to integrate multiple sensory inputs. You have to remember that individuals with sensory conditions experience the world very differently from us. Try to imagine a life where touching a cotton sweater feels like running your hands across a cheese grater, or that a common household light bulb is nearly blinding, or that a door closing softly is like a gunshot in your ear? What if walking on the seam of your sock felt like stepping on a Lego barefoot? Imagine that the texture of food is so painful and terrible that you decide you'd rather starve than eat another bite in your whole life. Imagine if every time someone touched you, it felt like they burned you, or that you're so numb or so overwhelmed that you bite or hit yourself just to feel something. People with sensory conditions live in a very harsh world, so things that might be normal or easy for us can actually spiral them into a sensory meltdown. If you're watching this video, then most likely your loved one has a very difficult time managing their sensory condition and might often end up in meltdown. Some individuals with sensory conditions have such extreme sensitivities that they spend a good portion of their life in chronic meltdown. When in meltdown, your loved one may have a limited awareness of certain aspects of their surroundings, an increased focus on seemingly trivial things, a limited understanding of the words that you might be saying, and a difficult time understanding who is a threat and who is a support. As a result, individuals in meltdown are at an increased risk of harming themselves due to impaired reasoning abilities, an increased risk of being harmed by others due to the misunderstandings of their behavior, and at increased risk of harming others in reaction to a perceived threat. Your loved one may exhibit an instinctual fight, flight, or freeze response of self-preservation by becoming combative if forcibly restrained or approached. They often lashed out at loved ones, law enforcement, or medical professionals who are trying to help. At that time, they see anyone and everyone as a potential threat. It is their body's instinctual way of trying to protect them from harm. So what do we do when our loved ones are in meltdown? How do we help them? How should we respond so that we can keep them safe and keep ourselves safe? Today we want to talk you through the scared de-escalation techniques. We want these techniques to be used in a step-by-step way, helping you to de-escalate your loved one when they are in meltdown. Scared is a program from the book Managing Meltdowns by Deborah Lipsky and Will Richards. Miss Lipsky has a diagnosis of autism and works as a first responder. She, along with Will Richards, a clinical psychologist, wanted to use their combined skills to develop a program for individuals with sensory conditions. At Lakeland Regional, we regularly and effectively use Scared to assist patients when they are in meltdown. So we wanted to share these techniques so that you can use them at home with your loved one. Scared. Safe, calm, affirmation, routine, empathy, and develop an intervention strategy. When using these techniques, it is important to use each one sequentially because each step builds on the previous one. Let's get started. Safe. The initial focus is to provide an environment that is safe and secure. Don't try to restrain the individual if at all possible. Also, don't leave a person in a sensory meltdown alone or unattended. Instead, attempt to remove unwanted stimulation or guide the individual to a less stimulating environment and remove social pressures from the situation. The core of safe is to make the environment safe for your loved one and for yourself. You want to remove any items in the room that could be used to harm someone, like objects that could shatter and make sharp pieces, or anything that could be thrown. Safe is also about making the environment safe for your loved one, which means lowering the amount of stimulation. Lower the lights, talk quietly, minimize the number of people in the room. Keep a safe distance, turn off the TV, lower the blinds. You want to make the environment as low stimulation as possible to decrease the amount of sensory information that the escalated individual has to deal with. Calm. Remain calm. Use concrete or literal language. Don't try to process what has happened or is happening. Do talk in a strong, calm, and reassuring voice. Calm is all about you as the caregiver. Make sure that their escalation doesn't escalate you. I know it can be overwhelming and scary to have your loved one in meltdown, but letting your tone of voice and body language escalate will only trigger them more. Consciously take a moment to center yourself. Keep your body language relaxed and non-threatening. Use a firm but calm tone of voice. Speak softly but clearly. Affirmation. Provide validation and acknowledge that the individual is doing the best they can to resolve the situation. Don't ask unnecessary questions or challenge their responses. Do refer to the individual by name and acknowledge their fear. Sometimes just simply hearing your voice saying their name, acknowledging their fear and your love for them can make a big difference. Billy, I can see that you're scared. I love you no matter what. I'm here for you. Routine. The individual's comfort zone is far more likely to be in their repetition of routines. Don't attempt to interfere with harmless routines like repetitive statements or rocking. Do reflect their behavior and perception, encourage their routine, provide environmental supports for their routine, and offer reassurance. You know your loved one the best. Are there certain routines or coping strategies that help them, like rocking back and forth or putting on a favorite song or lullaby? Have your therapists or doctors recommended activities to use, such as counting or deep breathing? Using the things that your loved one enjoys helps to support them. Empathy. Understand from the autistic individual's perspective. Don't lecture about the effect that their behavior is having on others. Don't humiliate or shame them. Acknowledge their fear and show that you are there to support them and not to make them do something that they don't understand. I know that this one is both easy and hard. You love this person. They are your family. You, more than anyone in the world, know what they struggle with every day. I also understand that caring for someone with a sensory condition can be exhausting, and you often don't get the respite and support that you need. Oftentimes, your family and friends may not even understand what you're going through, and they may not know how to support you. At the end of the day, though, we know that it isn't your loved one's fault. They didn't ask for this diagnosis, just like you didn't ask for this. Compassion and empathy are so important for them and for you as their caregiver. Develop an intervention strategy. An intervention plan reduces the frequency, duration, intensity, and negative outcomes of meltdowns. It shouldn't be a generic strategy, and it should be developed with thorough consultation with the family and the individual with autism. Work with the individual to develop concrete behavioral strategies for assisting during a meltdown. At Lakeland Regional Health, we use our BRAVE program to help train staff on how to handle a sensory crisis. At home, coming up with your own plan of what to do and what steps to follow can help to take some of the uncertainty out of things. Build an action plan for what to do if your loved one is becoming escalated. Share that plan with your family, friends, neighbors, and other caregivers. It should include concrete plans for how to react in public and private, and who to call for support. Thank you for taking part in our Brave Caregiver class. We hope that this session has given you techniques and support for how to help your loved ones when they are experiencing a sensory crisis.